So let's talk about some tests that we do for lungs, respiratory tests. Some of these you already know. Oh, look, we're going to do ABGs again. Everyone's very excited about ABGs. Here we go. So ABG tests, here's some normal labs. You remember those? Here's some terms you might not be familiar with, but we'll just recap them. Hypercapnia is an increase of pCO2, so your CO2 level is hypercapnia. Hypoxia, everyone knows, is a decrease in oxygen in your blood. Hypoxia is a decrease in O2 in the tissues. So here's a question for you. What are early and late signs of hypoxia? Okay. So flow rate. We put a mask, nasal cannula on all patients, but what does it mean? Why do we do it, and what's the difference between everything? Well, your percent of oxygen a patient's receiving through nasal cannula, 1 liter is only 24%. 2 liters you get 28% oxygen. 6 liters 44. Simple face mask 55 to 60 with it turned up at 8 liters. A non-rebreather is up to 90%. You want to make sure you inflate the bag if someone's on a non-rebreather. Venturi masks are kind of cool. You basically dial in the amount of oxygen, so you have certain gauges on them that says, okay, I want 25, 30, 45%, 50, 60. So they're very exact. I don't see Venturi masks used very often, but they could be, but they're out there. Probably it depends which hospital or which state you work in or which country even. Chest x-ray. Someone's going down for a chest x-ray, make sure they have removed all their jewelry, metal objects from the chest area, and ask the patient if they're pregnant or possibly could be. If the patient has a defibrillator in their chest, they obviously can't remove that one. A sputum specimen. So they either expectorate in the sterile container or they do a collection out of a suction. Tracheal suction can do it. So you want to do that in the early morning after they wake up because they usually have more sputum there. It should be about 15 ml. Rinse mouth before collection. Take a deep breath, a couple deep breaths, and then cough deeply. Sometimes you have to explain to a patient, we want sputum from your lungs, not spit. A lot of patients have spit. What do you mean spit? Okay. And if you can, always do that before antibiotics are given. Bronchoscopy. Bronchoscopy is like an EGD, although we're taking the tube down into the trachea, through the trachea, into the bronchus. So we're doing direct visualization of the larynx, trach, and bronchi. Hopefully, if you can, if it's not an emergency, patient should be NPO just so they don't gag and aspirate and vomit. Sometimes you can't do that if it's emergent. You need the suction equipment like an EGD, sedation because it's like doing an EGD, so need some sedation, vital signs before and after. Doctor can take pictures, they can do a biopsy, they can squirt some saline, so they usually do what's called a bronch washing. A washing is where they squirt saline, suction that out, and there's cells in that saline then they can send to lab. So a bronchial washing. Complications from that obviously is if you perforate the bronchus or it causes a hemorrhage or a pneumothorax, things of that nature would be a complication. So pulmonary angiography, kind of like a coronary angiography, well, it's a pulmonary. So it's a fluoroscopic procedure. Catheter in your femoral or AC vein. They put the catheter up there, shoot dye. This is radiopaque dye, meaning it is what? Radiopaque. You're going to check your allergies, make sure they're not allergic to fish. Iodine. You want to make sure the creatinine level is not too high because we don't want to throw out their throw out their kidneys and cause problems with that. Patient should be NPO as much as possible. Sedation. Lots of times when they shoot this dye, the patient reports the flushing, cough, salty taste from the dye, hot flush feeling from top to bottom. Another one is ventilation perfusion lung scan. This used to be the standard for a patient that had a pulmonary embolism. They now can use a CAT scan, but this is what they used to do. So it basically is looking at blood flow and ventilation both. So they're shooting dye. The patient has to follow directions, take a deep breath in, hold, let it out if they want to see perfusion. A little bit of sedation for this one. And then because of the dye they use for this, it's basically radioactive. So gloves, not just latex gloves, but rubber gloves need to be worn to get rid of the urine when it's being discarded. Wash hands very carefully. Here's a picture of a barrel chest. Patients that have barrel chest, lots of lung problems, emphysema, COPD, they develop what's called a barrel chest. Notice it gets really big because they're trapping a lot of air. They've used a lot of accessory muscles to breathe, which get more pronounced.